Before you begin CPR, if you do not have a pocket mask, you can still begin CPR without it. If you do have a pocket mask, it includes things that you need, such as instructions, gloves, the sanitizer wipe, the air valve, and the mask itself. Before you begin CPR, you need to check for pulse. If the person you're checking does not have a pulse, and only if they do not have a pulse, that's when you begin CPR. You should never perform CPR on somebody that has a pulse. The gloves and the air valve are used to prevent the transfer of bodily fluids. You should not perform the breath part of CPR without a pocket mask. You should wash and sanitize your hands before and after any first aid attempt. We will talk about the Good Samaritan Law a little later, and you should always try and contact EMS before performing any first aid. This video actually shows how the valve prevents spit and the person's air coming back and forth between each other, if it'll load. So these little dots are your spit, and it's caught by the cotton part of the valve, and when the air from the person that you're giving CPR to is released, this little valve pops up and is released out the other side. When you put your pocket mask together, you should pop your pocket mask out fully if it requires to be popped. Some of them do not. You should insert the large end of your valve to the pocket mask, having the small one face away from where you would put the nose. For adults, that would be the part labeled nose, or for children, if you're using it upside down, you would turn it towards the part that says nose. Okay, so you should place the palm of one hand on the sternum, the lower part of the sternum. If you're not sure where that is, it's about in between your breasts. You can actually feel where it is. You should place your other hand on top of that one, being careful of any rings or bracelets that you may have, as those can injure your hands. And you should never curl your fingers in the other hand like this. You will possibly break a hand, and it makes it impossible to perform CPR. You should do 30 compressions, waiting for recoil before you start the next compression. You also need to count out loud so that you know where you're at. There's a 2-inch standard on how far to compress the sternum for adults. After the 30 compressions and you count out loud, you'll follow up with 2 breaths. You put the pocket mask on the bridge of the nose and the chin, and use your thumb and your index finger to create an airtight seal, giving 2 breaths as normally as possible. You should look for the chest to rise and fall. If the chest does not rise, you are not giving enough air. Children, however, only require 15 compressions per breath. If the child is small enough, your mask may be used upside down to create an airtight seal. You would use it as you did the adult by placing the flat end on the bridge of the nose and the triangle end on the chin, using your thumb and your index finger again to create an airtight seal. Your breath should be half as much or less as you did the adults, and your compression should be 1 to 1 1/4 inch, depending on the size of the child. Now, if you're doing CPR correctly, broken ribs are a possibility. This is where the Good Samaritan Law comes into effect. If you happen to injure somebody or break ribs while performing CPR, the Good Samaritan Law says that you are not liable. CPR does not actually have to require a pocket mask or the breaths. If you don't have a pocket mask, simply continue with compressions. As you compress inward, the lungs will automatically suck in air, and when the recoil happens, air is automatically released. If CPR is done correctly, it can increase a person's survival by 25 to 40%, which is why accurate CPR is very important. To help you remember what we went through today, I have a little video that just quickly goes, 44-second video, that quickly goes over everything that we talked about, plus a little bit more. Of course, you should always try and get certified in CPR if you have the opportunity, but if you don't and you still wish to help somebody, hopefully this presentation will have helped you.
This is an emergency, victim down, look around, check for responsibility, and then call for help. Within 10 seconds, look for breath, check for pulse, if there's no start CPR to prevent death, if you're the only one. Place 2 hands on the stone, compress 2 inches on the throat, 30 compressions to the chest, then give them 2 full breaths. 1 compressions and 10 breaths from an edge you must give. The sooner AED is done, the greater the chance they'll live.
And that is actually all there is to CPR.